This bonus slide is on mean arterial pressure. You may have heard of it or you may not have. Okay, but I'm just here to make it simpler for you to understand. So, just like the name, mean arterial pressure is just a mean or average, all right? Mean or average. In math, when you had to calculate the mean or average of two numbers, you add the numbers and divide by two, isn't it? If there were three, you add the numbers, divide by three, right? Okay, so mean arterial pressure is just the mean or average of your systolic and your diastolic arterial pressures. However, there is a twist. You don't calculate it like your regular mean. So just stick with me. I'll get to why that is so. So it is more accurate, all right, and a better marker of blood flow to vital organs. That's why it's important to talk about the mean arterial pressure. It is more accurate as compared to just using your regular BPs. All right, it's more accurate, it's a better marker. It tells us that we have enough blood getting to our organs or tissues. And the normal range is between 70 to 100 millimeters of mercury. That's your normal MAP. All right, this is where we want our pressures, to fall within this range. Okay, we don't want it to go below 60 millimeters of mercury. Why? You need at least 60 to keep your organs functioning and alive. So anything less than 60 millimeters of mercury for your MAP and your organs will die. Okay, there will be ischemia and eventually infarction. So we do not want that. All right. Okay, so why is it that this isn't your regular mean or average? Why can't we just add your systolic and your diastolic arterial pressures and divide by two? Rather, it has this weird looking formula. The reason is because the diastolic phase is longer than your systolic phase. Do you see? You want your heart to have enough time to fill with blood, to relax and fill with blood. That is why the diastolic phase is longer. So that's why the formula looks a bit complex. It isn't complex really. It's not complex. It just accounts for the fact that the heart spends more time in diastole. All right. So that's why it looks this way, and you can't just divide it by two. Okay. So what's the formula? Mean arterial pressure is equal to diastolic blood pressure plus one third of your pulse pressure. Very simple. Diastolic blood pressure plus one third of your pulse pressure. What is pulse pressure? Pulse pressure is just your systolic blood pressure minus your diastolic blood pressure. Okay, that will give you pulse pressure. So this is it. Then we have another formula. All right, it's equal to mean arterial pressure is equal to your systolic blood pressure plus two times your diastolic blood pressure divided by three. Okay, so you can choose any of the formulae. Okay, and you can experiment. You can write your own BP, use any of the formulae, or use both formulae. You realize that you get the same answer. All